welcome to SVGTV's news for Wednesday, November 17th, 2021. I'm Triska Campbell with the details. A 71-year-old male who tested positive for COVID-19 on November 3rd and died today, November 17th, of COVID-19 pneumonia brings the country's death toll from the viral illness to 73. The deceased was said to be unvaccinated. Meanwhile, 33 new COVID-19 positive cases were reported from 292 samples collected on Monday, November 15th, resulting in a positivity rate of 11.3%. 9 new rapid antigen positive results were also reported on Monday from flu clinics. There are currently 10 patients admitted for COVID-19 to the Argyle Isolation Facility. All are said to be unvaccinated. 12 persons have also been admitted to the COVID-19 wards at the Milton Cato Memorial Hospital, and all are unvaccinated. 62 new recoveries were noted over the reporting period. 1,243 cases are currently active, and 73 persons with COVID-19 have died. 5,359 cases of COVID-19 and 4,043 recoveries have been recorded in SVG since March of 2020. With just 2 days left for frontline workers in SVG to take at least one dose of the available COVID-19 vaccines, one more category of workers have been added to the list of those who will be impacted by the new COVID-19 rules and regulations, which will come into effect on Friday, November 19th. The update on the statutory rules and orders 2021 was provided by Prime Minister Dr. Ralph Gonsalves on radio today.
13 categories: healthcare employees, permanent secretaries and heads of departments, teachers appointed to public institutions, assisted private schools or public schools, ancillary staff employed within public institutions or public schools, employees of the St. Vincent and Grenadines Community College, members of the Royal St. Vincent and Grenadines Police Force, prison staff within the meaning of the Prisons Act, Chapter 393, public officers within the Transport and Immigration Services Department, public officers within the Customs and Excise Department, public officers within the House of Assembly, public officers within the Environmental Health Division of the Public Health Department, and employees employed by the St. Vincent and the Grenadines Port Authority, the Argyle International Airport Company Limited, or employed to perform duties at an airport or seaport.
Prime Minister Gonsalves gave a further reminder of the 13 categories of workers who will be impacted by the new COVID-19 rules and regulations, which were issued on October 19, 2021, and will come into effect on Friday, November 19th.
And on Friday, there was an addition of one category. It's members of the auxiliary force and rural constables. Well, it was always understood that the auxiliary police came within the context of the police, but not special constables, and there are 6 of them. So this was amended because there was some doubt as to whether the auxiliaries were included, I was told. So this makes it absolutely clear that they're included, and also for the 6 rural constables. Some of the auxiliaries have vaccinated at least once, and some have not, from the information given to me first by the Deputy Commissioner and then by the Commissioner of Police, because the Commissioner was out and he came back 2 days ago.
The Prime Minister said that he knows persons are keen to know what will take place on Friday, but in the meantime, he is encouraging all frontline workers to get vaccinated. PM Gonsalves also urged public sector workers who are not in the frontline categories and who are not yet vaccinated to do so, or ensure that they take the required 2 weeks COVID-19 test or face the penalty.
In respect of those required to take the PCR test at least once every 2 weeks, those are the general public servants. And to make it plain, well, the first two tests are done free, so the public servants have to make sure that they get their tests. Because the rules make it plain that an employee who, without reasonable excuse, this is Rule 8 of these rules, an employee who, without reasonable excuse, fails to comply with Rule 4, Rule 4 deals with testing, or of Rule 5, which deals with vaccination, must not enter the workplace and is to be treated as being absent from duty without leave.
And Prime Minister Dr. Afghanistan said frontline workers need to be mindful of persons who are encouraging them not to take the COVID-19 vaccines, as they might be waiting for the opportunity to take their jobs.
Some more champions. You know, one of the interesting things is happening. There's some more champions in different places. They're telling people, don't take the vaccine. But they don't got the vaccine, you know. You know why they're doing that? They want their son, their brother, their uncle, their nephew, their daughter, their girlfriend, or boyfriend to get to not take the vaccine and leave the job now.
Yeah.
So then they could then come. Well, you know, I've been telling people to take the vaccine, you know. And I have a brother, I have an uncle, I have a Johnny P. You have to watch Snake in the Grass too, you know.
And opposition leader Dr. Godwin Friday said the government's approach in setting deadlines for people to get vaccinated against the viral illness is wrong. On Boom FM this morning, Dr. Friday said the government has to realize that its unilateral approach to hand down the hammer on frontline workers to get vaccinated or risk losing their jobs is not going to work.
I don't think it is the right approach. It doesn't send the right message, and it's not practical, and it is unfair to so many people who may be affected by it. But the position that they have adopted now is one, you know, you take the job or you lose your job, basically, and that is a strategy, really, which is intended to say, I don't care what you think, what you feel, how you are processing this, and how you're dealing with COVID, and what challenges you may think that you have. This is what I have decided as government, and if you don't like it, well, you can just take up your bags and walk. And to suggest that somehow this is not a mandate, that people have a choice. I mean, if you have the choice between your health and eating, it comes back to the same thing, because you are going to be very, very severely affected. People's rights, their employment rights, their benefits, the welfare of their families, all of that is threatened.
The opposition leader said instead of dividing the people, the government should take blame for not encouraging them enough on the matter.
Says that, listen, these people are the problem. You know, they're not really part of the solution unless they come on board with me. They are the problem. When in fact, what we ought to be doing is what we proposed at the very outset. You know, seeing this, that COVID is the problem. It is a national problem. It affects everybody, NDP, ULP, public servant, private sector, young and old. Everybody is affected. So everybody has to be a part of the solution. You can't vilify and simply divide the country up into those who take the self-righteous attitude, you know, that, okay, I'm a vaccinated, so I've done the right thing. You are not, and therefore you're holding the rest of us back. You know, it has to be much, much more inclusive. It has to be, just by necessity, it has to be inclusive.
Dr. Friday said while some people are philosophically against taking the jab, it is his view that the majority are not confident the vaccines will help rather than harm them, and that it is the major challenge facing the authorities which they should try to address rather than giving people deadlines to get vaccinated.
I try to explain to people I see and I meet, and to be honest with you, many of them have come around to it, but I can't reach and speak to everybody individually. but it tells me that the approach of engaging people is the right one. You know, we are a democracy. We understand that, and governments must lead, must make decisions. But at some point, in certain matters, especially something as personal as this, as putting something into your body, obviously the people in this country have decided, well, listen, I want to be able to make a decision myself. We have fewer than 19% of the population now is vaccinated. You know, that means that you have a vast number of people who are simply saying, even in our democracy, this is a decision. It is a personal decision. It is one that I will not relinquish to the government or any individual other than myself, and that I will make a decision. We have to respect it and simply say, well, where can we meet you to help you to make the decision that we consider to be the right decision, that I consider to be the right decision, which is for people to become immunized against the vaccine, the virus.
Making it clear that he is not against vaccination, but against forced vaccination, the opposition leader said while he would like to see everyone who is eligible to get vaccinated do so, as he believes it can protect them against the viral illness, everyone must come to this realization by themselves and not by force or threats.
That is the reason I did it. I did it because I believe it makes me safer, that my family makes safer. So I want everybody to have that. I've heard some people saying that, you know, because I said that I'm opposed to mandatory vaccination, that I'm vaccinated and I don't want people to vaccinate. I have never said that. I encourage people to, even where I have attracted criticism from even people who are friends of mine, who are supporters, and say that I should not be advocating it. I say I believe it is right, and I accept the science, and I do so. And similarly, how do we get there? It's taking longer than we anticipated. And we have to understand the reasons for that and try to find solutions to it. It's not going to come by blaming certain persons and making them feel that somehow they are not worthy, that they are not, that all of the things that we want to do for our society doesn't really include them, because they are the problem. When we say that we're going to help, this is all for the common good. 80% of the people have decided that at this point have chosen not to be vaccinated. Now that includes children and so forth, but then we think even the persons who are eligible to be vaccinated, the vast majority are. So we have to accept that as a fact. And then how do we go forward is the question. And it is evident to me now that it's going to take longer than we had anticipated.
The Ministry of Health is not satisfied with the number of large gatherings that are still taking place across SVG despite the regulations. Speaking on WeFM yesterday, Health Promotions Officer Shanika John said that this is one of the main challenges facing the Ministry of Health in its efforts to stem the spread of the viral illness and prevent another outbreak.
Several requirements. We've spoken to the churches in particular as it relates to weddings and funerals, but I think there's more or less almost like a disconnect when persons are within a particular setting and there's a requirement of 1/3 within the church or even 10 persons on the inside for indoor gathering. But once you're out in the public space, then we would see the long processions and so forth. And those are things that are still worrying for us, because those are things that are very high risk activity that could lead to multiple persons contracting the virus. I'm also still very concerned about the persons who still, you know, we've been a year and some in this pandemic, and there are persons who still don't want to wear a mask, who still don't want to get tested. This is not even talking about vaccine, who still don't believe that the COVID-19 is real. And so some of these persons have indeed tested positive eventually after getting sick and so forth. So these are some of the real challenges that we're still having right now.
The Health Promotion Officer said though in recent times the COVID-19 numbers in the country have been trending downwards, people should not become complacent and should continue to follow all necessary protocols.
I think it's a combination of both, of all together. We have persons who are not wearing their masks, especially when you are gathering for pleasure.
Yes.
You know, so those persons are not wearing their masks. There's no physical distancing, and those are the persons very often who don't want to get the vaccine. So there's a mixture within our population right now where there are persons who still want to live what is called that life of normalcy, but the requirements that will take them to to normalcy, they're still very hesitant about that. We have spent a significant number of times, I know there are a number of persons from the nursing area, from the doctor's area. We've had our chief laboratory technologist making his way as well. We've spent a lot of time explaining the protocols, what is required, and what is needed. I think for a lot of persons, Vincentians, it's not affecting them individually, and I think we saw it a lot when we started to experiencing a number of persons who died from COVID-19.
Misinformation about the COVID-19 vaccines and the pandemic is another challenge that is affecting the ministry's efforts to get more persons vaccinated. John said it is important that persons get their information from reliable sources or seek advice from their doctors.
We live in a era now where I can sit with my smartphone and hook it up,
yes,
and I can just talk, and people can listen to me, and that can go viral very quickly.
Yes.
And in the same way, the Ministry of Health or other organizations would put out information to counteract that, and it stops.
Yes.
It stops within a particular line. So it is very concerning, especially when we have persons who should know better. And this could go from church leaders, pastors, it could go from healthcare workers, police officers, all of the different sectors who will then stand on that particular side and say, the Ministry of Health is not doing this in particular, or we need to do X, Y, and Z, or this is a lie, the pandemic is a hoax. And people have said that to me directly to my face. But it's slowly changing. We have those persons who are very adamant of not taking the vaccine in particular, or not being tested, and now understanding the rationale behind those measures.
The police have launched an investigation into the circumstances surrounding a motor vehicular accident in Curtin's Barley today that resulted in the death of a 7-year-old pedestrian. The police say, according to reports, 40-year-old chauffeur Leron Gordon of Chateaubelair was driving motor vehicle H6405 from Chateaubelair heading into Kingstown at about 7:15 a.m. While driving along the public road in Curtin's Barley, the motor vehicle collided with Jaden Bob, a 7-year-old of Barley, who was a student of the School for Children with Special Needs. Jaden was said to be in the company of his grandmother at the time of the accident. The child was taken to the Milton Cato Memorial Hospital for medical treatment, where he later succumbed to his injuries. The driver is in police custody assisting with the investigations. A post-mortem examination is expected to be conducted on the deceased to ascertain the exact cause of death. This is the 5th fatality accident recorded in SVG for 2021. The Ministry of Health, Wellness and the Environment today joins the global community in observing World Prematurity Day under the theme Zero Separation. World Prematurity Day seeks to raise awareness of the challenges and burden of a premature birth globally. Pediatrician at the Milton Cato Memorial Hospital, Dr. Sherry-Ann Davis Andrew, said World Prematurity Day also seeks to highlight the brave and challenging journeys that infants and their parents have to undergo once they admit to the premature nursery at the hospital. The day is also used to recognize, celebrate, and congratulate healthcare workers who deal with premature babies.
To spend some time to thank those persons who are part of taking care of these little ones. So our NICU nurses, you'd find that our NICU nurses are so close to the parents and they keep in contact as if they're family members. So we really want to thank the NICU nurses, the sisters, and all the persons in the different departments or radiology departments or ophthalmologists. Numerous persons are a part of taking care of our little ones, and we want to thank them. I'd also want to thank our obstetric team, because even the care starts from very early. So our obstetric team will decide we'll work very hard to delay our premature infants as much as possible to keep the babies inside. And even in cases where they're unable to prevent a premature delivery, they ensure that the mothers are well counseled and educated and are aware of what is to come. And I think we worked well with the obstetric team, and we want to thank them for their support over the years.
Having a premature child can be very challenging, and Dr. Andrews explained that the care that is provided by the Milton Cato Memorial Hospital for premature infants.
Prematurity comes with numerous complications, and I would say probably the most common complication that we see in our premature infants is respiratory distress syndrome, in which our babies are breathing extremely fast and are very short of breath and need some sort of respiratory support. So what we provide is something called CPAP, which is continuous positive airway pressure. What it does is that it offers pressure to keep the lungs open, because the lungs are very immature in our premature infants. And sometimes we are also able to give oxygen as well. All right, and this is usually quite helpful for babies in the first few days of life who are having challenges with breathing. We also provide parenteral nutrition, in which we're giving nutrients through the veins. So it's not just that IV fluid where you're giving glucose or you're giving water, but we're able to give calcium, we're able to give lots of nutrients, sometimes fats and even amino acids and proteins. So when our premature infants are unable to eat by mouth, we can actually give nutrition through the vein.
Government, through the Ministry of Finance, Economic Planning and Information Technology, is implementing a Human Development Service Delivery project to reform the systems through which the various government institutions and agencies provide public goods and services to the Vincentian people. According to a news release from the ministry, the components of the project to build a responsive social protection service delivery system provides for the development of the country's first Disability Act. This new act is expected to provide adequate protection of the rights of persons with disabilities in SVG and ensure their inclusion or integration in all aspects of life within the Vincentian society. The legislation is to be guided by the UN's Convention on the Rights of Persons with Disabilities and should reflect current regional and international best practices applicable to the realities and capabilities of SVG. To this end, Dr. Jason Haynes has been commissioned by the government to draft the Disability Act 2021-2022, and he is seeking feedback from key stakeholders on the experiences of persons with disability and those working closely with persons with disabilities across multiple spheres, including health, education, transport, housing, and participation in public affairs. Persons are asked to complete a survey online by November 26th. For further information on the survey, you can contact the Ministry of National Mobilization.